Good evening, everybody. I hope everybody is doing well. Good evening, everybody. I hope everybody is doing well, and welcome to the Hustling Muscles Show. Yesterday, since we had a technical glitch, we thought let's do the session again since it was a requested topic. We were not able to go with our flow. So, I and Dr. Mukherjee have taken our time and we are doing this again today. And I see Dr. Mukherjee, so let me not waste any time and invite her. Okay, I have sent out a request, and Dr. Mukherjee should join us. And that's an amazing view, Dr. Mukherjee. You just showed us initially.
Yes, yes, that's
Thank you
the
so.
balcony that I have. Yeah,
That's a beautiful balcony. That's a beautiful apartment that you have. And Dr. Mukherjee, I
thank
have to
you.
thank you. Thank you for taking out time for doing this again for us. But since we had a
Sure.
technical glitch, I wanted this to be done so that the audience could have what we worked on. So, without wasting any time, let us start and go to the first question. Postpartum. What is postpartum? A lot of people want to know because a person like me and many others don't have any idea on what postpartum is. Can you start by just explaining this, Dr. Mukherjee?
Okay. So postpartum is the time exactly after giving birth to a child. Now, usually there are two terminologies, postnatal and postpartum, which are used interchangeably. But usually postpartum refers to the issues that the mother is having independent of the child immediately after birth. And postnatal refers to the issues that the mother is having with the child's birth. Okay. So usually one of the common things is postpartum depression, which is still not talked about as frequently as it should be because it is prevailing in almost 15% of women worldwide, okay, mothers worldwide who give birth. So this comes from a term called baby blues, which basically happens for 50 to 75% of women who immediately give birth. It starts from day two and then it goes on till about 2 weeks. So this is, as the name suggests, it's baby blues. That is like the physical, mental, and psychological separation from the child at that point. You know, you have been growing a baby for 9 months, and then suddenly you have given birth. So women go through a lot of anxiety, depression, sleep disturbances, mood swings, as well as they go forward with a lot of irritability during this time. Now, usually it subsides for about like 75% of women, but 15% of women, they still continue to have these symptoms. Okay, it can last for months, sometimes it can even last for years, and this can be quite severe. Okay, that can also lead to a feeling of detachment from the child. So here is something where exercises and physical activity, I mean, there have been a lot of studies which have shown that physical activity helps in reducing postpartum depression. And what I keep suggesting a lot of mothers, and what I feel even the gynacs should be suggesting if they are not already, that women should start exercising not just post pregnancy. They should start exercising during their pregnancy, okay, and even after they have given birth. So it should be like a continuous process rather than starting everything when your body is under so much of stress.
That's very well said, Dr. Mukherjee, because if I'm not wrong, I think a few celebrities, if I'm right, Anushka Sharma was one who I think had put up a post during her, pre-pregnancy time, that how she was working out and things like that. So,
Correct, correct.
pre-delivery time. So, these are things. So what you're saying is good. And like you always say, movement is medicine. So, you can actually
Exactly.
relate it to that. Now, moving on to my
Yes.
next question. What are the benefits of working out during postpartum? Does it help with postpartum depression?
It definitely helps with postpartum depression. In fact, there was a systematic review done in 2019, which included 18 studies so far, which have been done, and a recent study in 2020, which was done in Turkey. All of them showed that there was a positive psychosocial change in behavior. That means psychologically and socially, the new mother's interaction improved with their family, with their child. Along with that, there was reduced anxiety and depression. Now, a lot of it is because of the exercise's direct effect on the mental health. But now we all know that the physical body can affect mental health, and the mental health being low can affect the physical body. So I believe that a lot of this comes also from the indirect benefit that the physical body is receiving. I mean, women go through a lot of changes when they undergo pregnancy. For example, there is also severe back pain. There is a poor posture which is adopted. They are not able to do all of the activities in the full range of movement. So there is a lot of stiffness. Along with that, there is urinary incontinence due to the pelvic or vaginal muscles not working as with as much strength as it should. So there are so many physical complications that a woman suffers with. Okay, and this is not even the major complications that I'm talking about. There are other complications like diastasis recti, where there is a space which is built between the abdominal muscles, that's the rectus abdominis. So there is a good space wherein, like, it could be like between 2 to 3 fingers of space developing due to the extreme stretching of muscles. So the body goes through tremendous strain. Now, if exercise is able to take care of the physical body, release endorphins, take care of the physical ailments, definitely that will also be having a huge improvement on the mental capacity of the newborn, like the newborn's mother. Okay, because we know that mentally, if they are feeling good about their physical body itself, they look into the mirror, they are feeling good, they have endorphins in their body, definitely this has helped in reducing anxiety and depression. So all the studies have proven that there's a positive effect.
So those are golden words coming from Dr. Mukherjee to all the young mothers who have recently delivered babies. So, these are very good points that she's giving. I hope people are making a note of it. Dr. Mukherjee, my next question. When can one start working out post-delivery? This is the most hot question I have been asked when I, did my survey. Okay, what are the ways you suggest one can start? Can you give them a guideline? Everybody wants to know how they can start. They want a guide, they want a guideline. And how soon can they start? A lot of
Okay.
questions in one question, so you can break it down.
Of course. So, what I would suggest is before starting with any exercise, the mother needs to consider 4 things. First, how active was she before she became pregnant? Okay, was she doing a strength training or a jogging or running on a regular basis, or was she sedentary completely, not doing any exercise? Secondly, how active was the person with, like, during their pregnancy? Okay, was she doing any exercises, or was she completely bedridden during her pregnancy? That is number 2. Number 3 is, how was the delivery? Was it a C-section? Was it a prolonged labor? Was it like a regular delivery? No difficulties. And fourth was, were there any complications? Complications can be pre-labor also. Like, for example, the woman had gestational diabetes, or she had extremely high blood pressure. Okay, or the complication can be during the delivery also. Like, there was an excessive blood loss, or there was a surgery that had to be gone forward with during the delivery. So these 4 questions first need to be answered. Okay, so the mother should be talking to her gynecologist as well as her physical therapist and understanding this, and then go ahead with the exercise. Now, post 6 weeks, like after delivery, post 6 weeks, there is a very important follow-up which is done with the gynecologist. This is a very important appointment, should not be missed by any mother. This is when we get to know whether there are any complications which are still continuing or not. Usually for most mothers, by 6 weeks period, what happens is that the uterus reduces to its normal size, that is the size of a grapefruit. Along with that, the vaginal bleeding and discharges, that also stops to a huge extent. So the woman's health almost returns a little bit to normal, and we are able to know that yes, she's recovering well. Okay, and that is when we can take the decision of starting with the exercises. So it's very important to attend this post-delivery 6th-week appointment and then take the decision. If you are cleared by your gynecologist and physiotherapist to start with exercise and there are no complications that need to be taken care of, you can start off with 150 minutes of continuous exercises in a week. 150 minutes a week means 30 minutes in a day. Okay, so 5 days a week. Okay, remaining 2 days, complete rest can be taken. Now, I understand that for new mothers, even taking out like 30 minutes from their daytime can be extremely difficult. So what I plan for my patients who are new mothers is break down the 30 minutes into 10 minutes session. Have 10 minutes in the morning, afternoon, evening. Now, your question will be, what kind of exercises can we do? Okay. Do very low impact exercises. Easy exercise cardio in sitting, just moving the arms, legs in sitting, doing mild yoga poses, Pilates, even ballet based exercises help greatly because they help in improving posture, improving the stiffness, the tightness which has built up in the body. And you have to understand that the body is still not recovered completely. So very high impact exercises we will avoid during this time. And if you want to return back to your normal exercise, that is usually people's question, like, when can I return to normal? If everything goes well and you have exercised well, by 16 weeks, you will be able to return back to your normal level of exercising. So post delivery, 16 weeks after that, you can return to your normal exercise. Now, everybody's normal differs. If you were somebody who were very active, when before you were pregnant, you were going forward with a lot of strength training, or you were going forward with playing a sport on a regular basis, you will be able to get back to that level, probably with the help of right exercise. But don't expect miracles. It's not like you will be somebody who's sedentary and then post your pregnancy you will start to exercise, and then in 16 weeks you will start running. That's not going to happen. Okay, so you need to have very realistic expectations here. But whatever your normal was pre-pregnancy, you will be able to get back to that.
Okay, I think Dr. Mukherjee has explained it in a very well manner. And I think what I like the best about is when she said, take help from experts, especially, when you're at such a tender place, when you've just delivered a child, it's very important to get the right advice. If you're going to get a wrong advice, it's going to go haywire for you. So, at time, even if you need to invest, that's the word I would use, invest in a good fitness expert, please do. Because this is something very, very important. Because as you've understood the way she said it, that how you have to start that 10 minutes, and that's how the an expert would look at it. So this is something I would point out to the viewers who are watching it. Now, Dr. Mukherjee, moving to my next question. Women are delivering at every age today. You have women delivering almost from the age of 20s to the 40s. Is there a different fitness advice that you would give each one of them? The viewers would like to know.
Okay, so what I would suggest is, see, we have different fitness level for women in their 20s and women in their 40s. I would give advice or tell to go with precaution mostly for women who have been sedentary or who have not exercised at all, even prior to their pregnancy, because those women will be the one who will be having the most complication or take the most time to get back to normal. Okay. But for example, if I am taking care of a 20-year-old sedentary mother who has not exercised, and a 40-year-old mother who has actually been exercising and taking care of her health, and she's going forward with playing a sport or probably running marathons, probably the 40-year-old woman is not going to have so much of difficulty, because it all depends on the fitness level. So here, age does not really bring about so much of a problem. But yes, for 40-year-old women who are giving birth, the chances of complications, other complications other than physical, are going to be a lot higher. That is, there is a higher incidence of the baby having Down syndrome. High incidence, I'm saying, not surety. There's a higher incidence of that happening, higher incidence of gestational diabetes and BP. So again, all the more important that if you're planning on having a baby later at that age, I mean, science has advanced so much, okay? So there is literally no restriction at all. You can do that. But being physically active is the first and foremost requirement for it.
Science has advanced so much, fitness has advanced so much, and fitness experts are now keeping up with, the things, how they're advancing. So hats off to you, fitness experts, Dr. Mukherjee. So moving on to my next question. Are there any workouts that you would tell somebody to avoid post-delivery? Because, you have that tendency that I need to push, and people try to, do that extra bit. They may not have the knowledge, it hurts them, doesn't hurt them, how it is. What if somebody starts doing a workout like a HIIT, immediately post-pregnancy? What's your take on this?
So what I would suggest is, one exercise you should absolutely not try to do immediately post-pregnancy is any exercise which puts a lot of strain on your stomach muscles. There are many reasons because of it. Okay, first is definitely your abdominal muscle has gone through a lot of stretching and tearing okay, the muscle fibers during your course of pregnancy. So they are very weak. They do not have enough strength. So don't start with, a barbell squat or a full push up or a, like heavy weight exercise or HIIT immediately, which puts strain to those muscles. Number two, there is this hormone called relaxin. Okay, it actually does what it says. It relaxes all of the ligaments. Okay, so basically your joints are a little weak or a little loose during, like immediately post delivery as well, so that the body slowly comes back to normal. Now, immediately, if you start to push your muscles to the maximum intensity, your joints are not in the same position or they don't have the same stability or strength anymore. So definitely you will end up hurting yourself. And number three is for all women who go through C-section, okay, or cesarean operation. I would suggest that follow the same precautions you would follow for any major abdominal surgery. Of course, after any abdominal surgery, we don't go and do crunches, right? Or we don't do sit-ups immediately, because there are certain precautions, like the muscles and the fascia, they are all cut and reattached and stitched together again. So there will be a scar tissue. Okay, it will be painful initially and it needs to heal properly before you go forward with your exercise. So usually 6 weeks is a good time, but again, check for any complications which have arisen with your doctor, with your physiotherapist before you start off. And we can always change the exercise. I mean, people don't have to go directly to a full push-up. Instead of doing a full push-up, which requires a lot of abdominal strength, do a push-up on the wall. Okay, or do a push-up on your table, or try to do a plank on the table, which is a lot higher than doing it on the ground. Or go forward with simple exercises, like even all yoga asanas will not be suitable. Okay. Yeah, I think somebody is saying that,
That's
yeah,
Evan.
don't
That's
get on a
Evan.
rowing machine. Yes. 3 weeks. Yes, absolutely. I agree. Because you should not be getting on any exercises immediately, especially machine exercises should be avoided as much as possible unless your physiotherapist and fitness trainer gives a go for it. Okay. Why? Because we might not realize it, but all of the exercises where we are doing it with a lot of weight, our core muscles are active. The reason we are able to lift the weight is because the core is working. Now, post pregnancy, your core is weak. So first build up the strength. Build up the strength with easy exercises. Okay. You can do Pilates. You can do bar based exercises, that is ballet based exercises. You can do certain yoga poses. Don't go forward with a boat pose immediately. Okay. Understand that what your body can take, and then slowly and steadily recover.
Again, I think those are golden words coming from Dr. Mukherjee. I hope all the young mothers have made a note of all that, because this is one question that was asked to me when I was taking down my questions. So that's been answered. Now, Dr. Mukherjee, question myth, you need to bust this or answer this. Okay, one major question that ladies have is, can they exercise while they are breastfeeding?
Okay, so this is a huge myth that women cannot exercise while they are breastfeeding. There are a lot of studies which have been done which suggest that exercising, like light to moderate exercise, is not just safe, but it's also beneficial. So you should be going ahead with it. Okay. And as per, I know that a lot of people say that, oh, if you exercise, your milk is going to turn salty and all of that. So trust me, that is not clinically proven at all. And in fact, it doesn't affect the amount, the taste, or the composition of your milk at all. You can safely go ahead with exercising. In fact, it has a lot of benefits. You will have improved mood, improved energy. Okay. You will start to have weight loss during breastfeeding, as well as all of these three things will lead to a higher chances of bonding with the child, which is another thing that a lot of mothers suffer with, that women are not told, like how to start with breastfeeding or how to make the process easier. Girls, exercise is one of the best ways to make the process easy, to improve your bonding with the child, to enhance the process, to make it comfortable for you. Okay, so please go ahead with mild to moderate exercise, mild to moderate intensity exercises during breastfeeding. Make sure that you're not wearing anything very tight. So if you're wearing a sports bra and track pants, or like your pants should not be very tight. The sports bra should not be blocking the milk ducts. Okay, it should be very comfortable, easy to breathe clothing that you're exercising in. And please make sure that you are hydrating enough. Okay, you're taking breaks in the middle of exercise. Don't try to push yourself, go all out. Okay, take care of your body, and it will definitely help in, like, it will even promote, or it will improve your breastfeeding experience.
Well, I hope everybody made a note of this because this was one query that was trending on the internet. So I had asked Dr. Mukherjee. Now, my final question to you, Dr. Mukherjee. While I was researching what I found back, what I found, another problem that ladies have, a hurdle, I would say. Why bouncing back is a bizarre phase. Many women face this. Can you help and explain them out there? Everybody has a problem bouncing back. I know it's with everybody, but let's address this, Dr. Mukherjee.
So, first of all, I would like to congratulate all mothers who were actually successfully able to give birth to a child. I mean, you have to understand that it's the miracle of life. And if anybody is making you feel horrible, or making you, know that you should not look like you have given birth to a child, then absolutely ignore that person. It's a great thing. And there is literally no pressure. Take your time, guys. You don't have to follow on the footsteps of Kim Kardashian or Serena Williams, who literally have a village taking care of them. They might not even be running behind their child. They are not having sleepless nights. They're probably not doing as much as you might be doing without anybody's help while taking care of your child. So you do not have to get back to your ideal weight immediately, or in 2 months, or in 3 months, because you don't have to hit a ramp. You don't have to do a catwalk. You are not a model, probably. So you don't have to go through those extreme beauty standards that women are pushed through. Okay. Understand that your body has done something amazing. Okay. That's probably the best thing that the body could do, the most powerful thing. And it's okay to have a little baby weight hanging. So during the regular pregnancy, women actually put on about 25 to 30 pounds of weight. Okay. This is absolutely normal, and this is required for your body. Okay. Even while losing weight, make sure that you're losing it safely and you're not going forward with any crash diets or exercising like crazy. It's not a good idea, because you will be breastfeeding. And if your energy is down, you will not be able to take care of your baby, because you cannot pour out of an empty cup. So, number one, ask for help. Ask for help from your family members. Ask for help from the experts. Everybody out there is building, is taking care of the baby with a lot of help. So you cannot do it by yourself. You're not superwoman. Okay. You need help. So please don't hesitate to ask help. Get in touch with somebody who helps mothers lose the weight safely, efficiently, and sustainably, and start off with an exercise program like that. Even a dietitian who can help you with the same. And keep checking with your gynac. Number two, go forward with core strengthening exercises and a little bit of cardiopulmonary muscular training. All of this is required. Okay. It's not just that you need to have a flat tummy. Okay. You need to build up your body again. Your body has been through tremendous stress for almost a year. Okay. Like at least 9 months. And, even post the delivery, it's happening. So understand that a lot of strength training and cardio exercises is required to get back to normal. Number three is, please continue your prenatal vitamins. Very, very important, because even after giving birth, you are taking care of two people, yourself, and through breastfeeding, you're taking care of your child. So it's important to take your micronutrients that you were taking prior to your delivery as well. Okay, because you need to take care of your health as much as you need to take care of your baby's health. And fourth is breastfeeding. Breastfeeding really helps in losing all of those calories very soon. Okay, it has been proven that women who were breastfeeding continuously lost a lot more weight. It has been proven in research, than women who were not going through that. Even women who were continuously exercising, of course, were losing weight more consistently. Okay. So there is no goalpost here. There is nothing like, you don't have a 3-month deadline that you need to lose weight and you need to get back. Please take your time. Please listen to your body. That is the first thing that I would tell all mothers out there. Do not push yourself into a diet or an exercise regime which does not support your body, which pushes your body through a lot of hardship. So see what is sustainable for you and continue with that.
Bravo, Dr. Mukherjee. I think nobody could have put it better. I think the way you said, it doesn't matter. Giving birth to a child is not easy. Okay, especially if the child is like me, because I remember when the story goes on, I was like a football, was what it was told, and I don't remember how many pounds my mother would say, but I was a huge baby. So, it is very, what you've said is not easy because, see, it's coincidentally, I have my cardio game, I have changed, and, I'm wearing this weighted vest. Okay, this is actually my punchline. I'm telling it before you. I'm wearing this weighted vest, which is 10 kgs. My God, walking with that is so much at times impossible. And I'm huffing and puffing, taking breaks. So it's hats off to you women, how you guys carry us. And especially if the baby is like me, because I was known as, like a football, because I used to play football the whole night. My mom would say I couldn't sleep. You were like this. So it's hats off to you women. It's not easy to, do something like that. And as you said, if you're a young mother, if you're a new mother, there's nothing wrong. The way you look, you should be proud of it. You should carry it that way, I would say. So, Dr.
Correct.
Mukherjee, I gave off my punchline for today. Now it's your turn.
What I would like to say is strong mothers grow strong babies. Okay. So you should not be thinking about starting off with your fitness just because you are pregnant now. You should be working on staying fit, like consistently, okay, staying healthy. Get on a strength training program. Even if you're trying to get pregnant, make sure that you are physically healthy, okay. Your body will be going through a lot of stress. Not just your body, mentally also you'll be going through a lot of stress. And there is nothing better than physical exercise, which can help you through that physical and mental stress and strain that your body is going to be going through. Secondly, if your doctor is not suggesting any exercise and telling you to take bed rest, make sure that you check the complications that you have and get a second opinion or a third opinion or a fourth opinion, really, if it's needed. But make sure that if there is a way possible, stay active during your pregnancy as well. Because like humans are the only mammals in the animal kingdom who do not move around when they're pregnant. I do not know what happens. We are told that please don't move, please don't bend, please don't do this. I mean, if I am not physically active for 9 months of my life, how do you expect me to be physically active after the baby comes? It's quite impossible task. So it is important, it is necessary to be having some sort of an exercise regime even during your pregnancy and even after your delivery. Start off from post 6 weeks period, but please continue that so that you are able to do the best you can for your child as well.
That's again golden words coming from Dr. Mukherjee. As I always like to say, she's the ocean of knowledge, and she shared quite a bit of knowledge. And what I like the best is strong mothers have strong babies. Correct, Dr. Mukherjee? That's what you said, right?
Yes, yes, yes.
Strong mothers give strong babies. That is the definition I'm going to give. So maybe today evening's post is going to be with my mother, me flexing my arms and tagging Dr. Mukherjee and saying, strong mothers make strong babies. Well said, Dr. Mukherjee. I really like that line. So I think we are going to end it at that. I again thank you for taking out time and doing the session
Sure.
again with me. It was an amazing session, and I'm going to be sharing this towards the evening. I will be again reposting it, so people who have missed seeing it can see it again. And guys, if you have liked the session, please do like it. Please do share it with young mothers who need help. And if you have any other topics, any other things, please do let us know, and do comment if you like our content, or if you want us to improvise or say something or talk on topics you like. We would be more than happy to. Please follow Dr. Mukherjee. Please follow me. If you have any queries on fitness, health, anything, DM us. We are there to help you. Okay. So guys, thank you so much for tuning into the show. Dr. Mukherjee, I thank you so much for your time again. So this is Dr. Mukherjee and Hustling Muscles signing out of the Hustling Muscles show. Thank you so much, Dr. Mukherjee. It was an amazing
Thank
chat.
you. Thank you, guys. Have a good day.
Thank you.